Okay, thank you for coming. You are coming from Bulgaria.
Yes.
Our neighbor country. We are we have many patients from very far away and sometimes from neighborhood too. You have chronic cystitis, right? For how many years?
Around 30
30
years.
years.
I'm now 35.
35, so 25, no, 20, 21, 22.
Yes.
Okay, it's very long time, and always there is a reason. Sometimes the sexual activities may be the reason. Sometimes in the childhood people have this, but some women are prone to get these infections. In some women, it is easily treated by one box of antibiotic, but sometimes it is not cured and it becomes resistant to antibiotic. It becomes stick into your bladder. So how was your story? What happened, and for how many years are you struggling with this disease?
It's been 13 years. The first time I contracted the disease from a swimming pool.
Yeah.
And I had very short course of antibiotics, like 3 days.
3 days, yeah, I hate this 3 days treatment. It is not really, it's maybe helping 90% of the women, but this 10% is going into chronic stage. So I never give these short treatments. Yes, then?
Yes, then started to repeat again. Then I again had short courses.
Yeah.
And it continued like a year like that, and
Yeah.
it started to become more chronic.
So what's the longest period you used antibiotics continuously?
My longest period is like 3 months and a half last year.
Okay, last year you used 3.5 months, 3.5 months of antibiotics. Which one, do you remember the name?
Augmentin.
Augmented, okay. So, and how many months do you use Ciprex continuously?
Like 8 months.
Okay.
First few weeks I had the pain in the bladder became worse,
Yeah.
but then it gradually subsided,
Yeah.
and now I don't have any side effects from it.
Okay, so many ladies come here for this disease to me, and I operated, and you choose to come first. Now we did an office cystoscopy to you.
Yeah.
And so you are from our neighbor country, very close, so it is easy to travel.
Yeah,
and,
one hour is
yeah,
my
1
life.
hour. So we choose to do like that, and I am very happy because we see what's inside. People are very scared. They ask me, if you see nothing inside, what will you do? Because it's very expensive procedure, like 3,000 euros. And if there is nothing, it is done for nothing. But in your case, when we do cystoscopy, we saw there are very prominent leukoplakes. In some patients who are coming from UK, United States, sometimes from Sweden, in these countries they use extreme amounts of high dose and long-term antibiotics, and in some of them the superficial leukoplakia layer is healed, just the base, trigonitis, red inflamed tissues remain, and I think they are responding a little more lower response rate. They have a lower response rate. Because in Turkey, I was having 80% response, and in Turkey always there is leukoplakia like your case. Maybe this is because of some racial difference, because always in the eastern part of Europe, we have such cases, thick leukoplakia, abundant leukoplakia, and they respond better. If the leukoplakia layer is healed, and the remaining trigonitis, the response time increases. The response comes maybe 3 months, 6 months later, and the response rate, success rate is a little more lower. So I am happy we see your bladder. You had a thick leukoplakia, and you had a biopsy. I see the biopsy part.
Yeah,
When
so
did you have it?
About 5 years ago.
But in Germany,
In
you said.
Germany,
You say you go there for this issue, for this
for
disease.
cystoscopy.
What did they say after the cystoscopy?
Just that I have some lesions
Yes.
on my bladder,
Yes,
inflamed.
inflamed
And
areas.
just this.
And they took the biopsy.
Yeah.
Everybody asked me, hey doctor, I had cystoscopy before, I had biopsy before. Biopsy revealed normal tissue or non-cancerous tissue, or your leukoplakia. I am sure your biopsy revealed a metaplasia, which is the change of tissue to another type of tissue, but not cancer, normal change, benign change. So this doctor in Germany saw the leukoplakia. He just I will show the video. he just take the biopsy in between the leukoplakia, but he didn't touch the rest of the leukoplakia. People ask me why they don't take this leukoplakia out. I don't have a good explanation for that. Previously I was doing it in such a way, but one day one of my patients wanted me to clean all these tissues because she said, I am infected because of these tissues. I said, oh, these are leukoplakia. What does it mean? She asked. Trigonitis. What is trigonitis? Infection of the trigone. Then take it out. Why you are not taking? Why we are not taking? Why the others doctors not taking? Because it is not proven in the literature. It's useful to take these tissues out. So they are not doing, but I begin to do it. And you saw.
Yeah, like 5 years ago, my symptoms became constant, daily, and I always from that time see in my urine small flakes, either bigger or smaller, either like dust or bigger. Like
floating particles, the same particles we see in your and very interestingly, the part they had the biopsy, it healed.
Yeah, I saw it.
Because when we take the leukoplakia with the biopsy or my fulguration, anyway, when we destroy this tissue, the new tissue is healed in a normal way, and it is very resistant to new infections. Now in your cystoscopy, we saw that there is a small part that take out the biopsy, it is healed. This part is healed. If they take all of these leukoplakias as a biopsy, it will be healed completely. So still the urology world needs a proof. They can't do, especially in the modern developed countries, you can't do something which is not written in the guidelines, which is not proven to be safe.
But it could take 10 years.
Yeah, maybe. So we are trying to make some research publications. I am a little weak in these subjects, in scientific subjects. I am a performer, not the very scientifically research making doctor. But one of my friends is now conducting a research on this. I hope we will do it in a quick time, in a short time. So we saw your bladder, it's now good. We are now sure there is something wrong inside. If tomorrow, by chance, by luck, you are completely healed and never have the symptoms again, okay, go and live your life. And you are now in a better stage compared to your old days. But if you still having these issues, which I am sure because you come here for this, that means you are not very...
Every month I have several days flares now. I used to take 2 years supplements and antibiotics on and off.
And very careful living.
And very careful.
Yeah. So this is good to have previous cystoscopy, office cystoscopy, to be sure what's inside and to give the success rate, because if there's good leukoplakia, success is easier. But you are from a very close country, so it's easy to come for this. I recommend to do cystoscopy. We always see some things in the cystoscopy, but sometimes very severe, sometimes not too severe, and it differs the success rate, but everyone needs this cystoscopy if they are having symptoms for a long time and not healed with the conventional therapies.
Is my case severe?
Your leukoplakia is abundant, which is good for me. This is success rate is high. When we take out the leukoplakia, success is high. But sometimes I see only small leukoplakias, but the base is trigonitis. This is more severe condition. Your leukoplakia is abundant, it's better. So if you come for cystoscopy, we will like to help you. Thank you for coming. Thank you for being here.